Show Weekly Podcast Edition. I am your host, Dr. Caleb Slater, here with Chris, representing the everyman, color man, here to bring you just that fun information that I can't bring you. And we also have Jill, social media expert and very bad clapper. Okay.
That's been proven at this point.
Can't clap.
Well established.
Poor clapper.
Very poor clapper.
Yeah. So today's show is about anxiety. And most people wouldn't think of anxiety from spine issue, so we're going to talk about that. And then we're also going to talk about the way that the medical system currently handles symptoms and anxiety, as well as labeling a lot of conditions out there under the anxiety umbrella. Mm-hmm. So where do you want to start first, Chris? You represent the common person, so.
Yeah, I mean, I think whenever you put anything out on the internet, people will pick and choose the parts of what you say and disregard everything else. So I think context matters in this case. So I think we should be open about anxiety in general. When you say your back can cause anxiety, you're not discounting the fact that anxiety can also exist in other ways.
No, not at all.
Yeah.
And that's the whole underlying premise of this show. My philosophy is I am not saying the spine causes all of these things. I'm saying the spine can lead to this and needs to be checked. And how many people out there, when they're having symptoms that are presenting like anxiety, are getting their spine assessed in that process of their diagnosis?
Right. So I have been diagnosed with generalized anxiety disorder and all that stuff since high school. So 5 years ago, just kidding, 20 years ago at this point, almost. And the treatment for that through the decades has been largely the same. And it's mostly different variations of SSRIs and medications.
Primarily medication, right?
Primarily medication.
I'm assuming some psychoanalysis, Therapy.
And honestly, having gone through all those things, this also kind of fits with your mantra about checking your spine and all that stuff. The things that help my anxiety the most are usually movement and exercise.
Well, and one thing too, and we're talking about how the spine can, and it's weird for me that you have to now tell somebody that a physical problem can cause mental issues, because up until about, I want to say maybe 60 years ago, it wasn't well known that a psychological problem can cause physical issues. And we now know that as psychosomatic presentation, right? But the term psychosomatic didn't really become popular until about the 1960s, 1970s. The fact of psychological trauma causing other manifestations, physical manifestations, didn't really start becoming too well known until post-World War II. And again, adopted in the medical society in the late 60s, early 70s, and even then it was still kind of not necessarily widely adopted or accepted. Nowadays, it almost seems like the reverse is true. That if I were to tell you that your physical problems could cause in some variation your mental issues, your mental struggles, your anxiety, people don't, that's less common, that's less accepted.
Yeah, I think maybe the pendulum swung too far to that side, right? That's so a lot of what you're talking about, the World War II stuff, though, like that's trauma based, right?
Right. But that's how it got. That's how it became incepted into the medical field, or that's how the medical field started to form around the idea of it, and then the idea of psychological manifestations in a physical form, then slowly became more and more accepted, and then the it used to be that you had to have some heavy trauma, war, right, in order to get that, and then it became less and less of that barrier to those symptoms.
Yeah, and that makes sense. So what would you say in general anxiety is? How would you describe anxiety?
Well, that's really tough, because you want to say, like, in the physical sense, right? So in a physical sense of anxiety, it could be just basically prolonged symptoms, pain over time, presenting, making you worry about going out of your house, making you worry about tolerating that 2-hour car ride, making you worry about going out to a baseball game and sitting there for 3 hours and possibly being in pain or limited in other ways. A lot of people have symptoms of GI issues. They can't be too far away from a bathroom. They don't, if you say, hey, let's drive here for an hour, their first thought is, what if I have to go to the bathroom? What if I soil myself, right? And that over time, that's gonna cause social anxiety.
Yeah.
The fact that you're not going out and enjoying your life is going to cause more anxiety as well. Like if I say, hey, let's go for an hour car ride, and your first thought is, man, my neck is going to hurt so bad, I'm going to start to get neck pain, a headache, my shoulder is going to hurt, instead of, wow, I really would enjoy that. And you're thinking about, not just the journey, but what you're going to get to, you're excited about it.
Yeah.
And if you extrapolate that over time, you're going to say yes to less and less. You're going to be less and less comfortable in your body as your symptoms progress.
Yeah, that's interesting. Your approach there, the way you're describing anxiety, is not the way I was thinking, but it is such a multifaceted thing. Like you're talking about, like you have physical pain, you have something, and now you are making adjustments to your life because you're worried about dealing with that physical pain or the symptoms of it.
Well, and I'm saying that's one avenue of it, right?
Yes.
Another avenue is psychological, and it can either be trauma-based or, I don't want to say in your own head, that's not a great way of describing it, but it can be more internalized.
I think you can get entrenched with anxiety, because I've felt before where I'm like, oh, I'm almost anxious about being anxious for something. Like there's not even actually anything to be anxious about, but I'm anxious about getting anxious, which is like a vicious cycle in and of itself.
If you'd like an appointment, go to thespinaltruth.com and schedule today. We offer both in-person and telehealth appointments, and unlike the medical system, we look to the root of your problem. We look to find the cause, the why your problem, your symptoms are there in the first place, and we expect quick improvement. We expect improvement in pain, range of motion, or strength in the first visit, and 50% or more improvement in most conditions within 4 to 5 sessions. So if you're tired of being in pain, if you're tired of the medical system and its approach failing you, and you want something different, go to thespinaltruth.com and schedule today. Now let's get back to the show.
And I feel like we've done that in the medical system. Some of the stuff I talk about, like fibromyalgia used to be the catch-all. Fibromyalgia, if they couldn't figure out what was wrong with you, eventually you would get labeled with fibromyalgia. It was the umbrella, the net that caught all the conditions that we couldn't put into a box. It's almost become anxiety. Anxiety now, how many people out there have gone to the doctor and they're starting to get told that they might have an anxiety issue, and they're thinking, well, I didn't think I had anxiety. I don't feel anxious. A lot of my patients are saying this, like, I was told I had anxiety. I don't feel anxious. And the medical system is almost starting to incept people into saying, yeah, maybe you have anxiety. Maybe you're anxious. Maybe this is the root cause of all your problems. And when you go out and you don't know what's wrong with you, and your doctor, a well-educated person says this might be the problem, you can't help but think maybe this is the issue.
Yeah.
Yeah, it's interesting you said that, because I was looking up what causes anxiety, and one of the things that I always had heard was that it's a chemical imbalance in your brain. Yeah. So then as you were talking, I was like, I wonder how they would test for something like that, and there is no test to do that, which is kind of, feel like an idiot because I have believed that for so long, but I had heard that from so many different doctors saying, oh, it's just a chemical imbalance in the brain, which is why I thought people took SSRIs to kind of, I guess, like counterbalance that or something. But that's kind of interesting.
Well, it adjusts your serotonin levels, right?
Right.
So I've also heard that the chemical imbalance thing for decades at this point, and so it makes sense of why I'm going to pop these pills, because there's something in my brain that's wrong, and this is going to level it out. And having gone through the SSRIs and different versions of these pills, they do affect you and manifest physical symptoms of other things, and the ones that were the most effective of tamping down my anxiety also tamping down a lot of my personality and feelings in general. So for me, what anxiety has always been is a lot of fight or flight moments and they can just happen. I can be sitting there and all of a sudden I can feel a jolt and I feel like I lost my breath, and I don't know why.
So I'm really glad you phrased it that way, because going back to the question, to me, what causes anxiety? And we said your physical symptoms, pain, having to go to the bathroom, numbness, tingling, nausea, headaches, dizziness, whatever, your physical symptoms can limit your world.
Yeah.
That can lead to social anxiety, that can just lead to depression, that can lead to anxiety, right? Then we have the chemical imbalance. That can lead to anxiety. It may be the more mental aspect of it. But you just said something, your fight or flight, right?
Yep.
So, and here's my spinal explanation of anxiety, is that your sympathetic nervous system is your fight or flight. Once that gets stirred up, it causes increased heart rate, increased blood flow, it causes increase in adrenaline, it causes decrease in your GI system, in your stomach. So basically, when you stir this system up, it's getting you ready for action.
Right.
In order to get ready for action, you need blood flow to your extremities, to your muscles, your digestion goes down, your pupils dilate, your sugar goes up, okay? So, and this system is housed in your thoracic spine. So if you have a thoracic spine problem and it's putting pressure on this system, you're going to be more easily agitated. And the patients that I've had that have said that their anxiety has significantly reduced, they've had a thoracic spine problem. And one of the ways that that system gets stirred up is prolonged sitting. So you'll get people that they'll get into a car ride and 30 minutes, 45 minutes, an hour in, or they're just sitting at their computer desk. All of a sudden they feel stirred up.
Yeah.
All of a sudden they feel agitated, hot. They feel like they're kind of uncomfortable in their skin, in their position. Their heart rate's elevated. Their blood pressure might be elevated. And think about what happens to your body too if your adrenaline goes up, your blood sugar spikes. What happens? You start getting shaky, you start getting nervous, you start getting anxious, unease, right? All of the same symptoms that could look a lot like anxiety or a panic attack can be from a problem in your thoracic spine, putting stress on your sympathetic nervous system.
And that's why I said that maybe there's some correlation there, but for me, what has been the most effective for anxiety has been movement and exercise. And whether that is because of the movement, my thoracic spine is performing better, or whatever you want to call it, sitting better, or it's just the chemical in my brains or whatever being adjusted because of movement. I don't know. I'm not a doctor. But there is something to the movement.
Well, and so that's another good kind of facet to this, right? People are going to say, well, how do you know which one, right? We kind of gave three relatively valid explanations for anxiety. It's purely a cognitive condition that has possibly a chemical component to it. It's purely just a prolonged physical manifestation, limiting your life, your happiness, your social interactions, or it's a direct physical cause to your sympathetic nervous system. So which one is it? One of the solution is kind of pick one and treat it. Yeah. Right? Well, if it's a chemical imbalance, then getting that proper chemical, we'll call it realignment, proper chemical balance. Should work relatively well, relatively quickly. Yeah. If it's a thoracic spine issue, like I'm saying, getting the proper treatment to the thoracic spine issue, and this isn't overly difficult. Jill's kind of been going through this a little bit, and she can speak to it. Mobilize your thoracic spine into extension. Again, it happens in sitting because we flex our thoracic spine in sitting. So, and that can actually explain why this anxiousness is becoming more and more predominant, is because we are a more sedentary society. Yeah. I mean, significantly so than 10 years ago, than 20 years ago, than 50 years ago, right? Yeah. So mobilize your spine and then get some muscle contraction in that range and give that about maybe 5 to 6 weeks and see if that helps. If that helps, that was at least a contributing factor, if not the underlying cause.
Yeah, it's just another tool in the tool belt for this kind of thing that's so broad in its treatment.
And again, for my value, for me personally, it makes sense to at least try that route first before going the chemical route. Unless somebody is, we'll call it, very emotionally unnerved, disturbed at that time, and they need, immediate, chemical treatment, right? Yeah. Okay, fine. But if that's not the case, if it's not in a medical emergency, then why not give it 4 to 6 weeks of this first before you resign yourself to medication.
Yeah, I don't think doing a foam roller on an airplane is going to cause my airplane anxiety to go down, but no, I hear you there. Another avenue for this kind of thing is, for me, whether my anxiety exists in a general way or not, if my body is feeling a little bit different, that will cause my anxiety to kind of spiral as well.
Right. Physical symptoms can cause emotional response.
Yes.
Yeah, and that should be more easy to adopt and accept than the reverse.
Right.
That your emotional state can cause physical symptoms. Again, not until the 60s or 70s were we even starting to accept that broadly, right? But now that is so broadly accepted that that is the norm. That we think that if you have some type of undiagnosed, ununderstandable pain, symptom, because it's so commonly accepted that a mental issue can manifest physically, we just now easily apply that. We say, all right, psychosomatic, it's anxiety, this is what's causing you, or let's get you on SSRIs.
Yeah, I mean, so like a placebo. It does nothing really, but your mind thinks it does something, so it affects you physically. Why wouldn't we think the opposite as well? Like, our mind and body are so connected, right?
Well, and again, I'm not saying it's purely a physical problem, that it's purely that you have pain or other physical limitations and that's causing your issues. I'm not saying that it's purely your thoracic spine putting pressure on your sympathetic nervous system causing your issues. I am just saying that that is a possibility, so why not try that first?
And so what does that look like? How does that treatment look like?
Probably about 4 to 6 weeks of doing the foam roller exercise that I show a lot, and then also strengthening some of the muscles in that range to keep your spine there, to keep pressure off of that nervous system.
So, okay, so let's get deeper into this whole thoracic spine thing. The reason you want to target your thoracic spine is because the nerves there do what?
They affect the sympathetic nervous system, your fight or flight.
Okay, so that's triggering it, potentially.
Yeah, and kind of putting it on higher alert. If you think, like, let's say like your baseline at rest is 0. And let's say if you have to get to, let's say 50 to cause an action, to cause a symptom. Do you know what an action potential is?
No.
Basically, like, until something happens at this level, you won't see any effect. So it has to, like, the level has to keep getting higher and higher and higher, and as it's like maybe a cup overflowing. You can start filling a cup, and nothing's going to happen until it gets to a certain level. Then it starts to overflow. Now you have a problem.
Okay.
So now your cup, instead of resting at 0, empty, is resting at half full.
Gotcha.
And now the stressors that you put through it, sitting for an hour, going out and listening to a band and jumping up and down, whatever, the stressors that you put through it that wouldn't normally create that action potential, wouldn't normally create that symptom, now do, because it takes less to get there.
So is this something that kind of builds over time of
absolutely. Yeah,
okay.
100%. And I would actually bet that a lot of people, and I see this in my kids. I have 2 young daughters, 9 and 11, I think, and I'm starting to see them slowly getting slumped like old ladies.
Yeah.
Right? And so I have them do these exercises, but I'm their dad telling them to do their exercises, so you know how well they listen to that.
Yep.
But that never happened to my generation because we didn't have computers. If you were on a computer, you were on the computer in literally the computer lab that you got to once in a while.
Yeah.
You know, and you're playing Oregon Trail, and it's one person at a computer and like 3 of your buddies standing over you watching you play, right?
Yeah.
And then we didn't have iPads and tablets, and we didn't go home and have a TV in multiple rooms, right? So we were much more active. You were much less sedentary.
Yeah.
With my children, who we're pretty good about limiting their tablet time and stuff like that, but they go to school, and I've seen it more in the school days or more throughout the school years, that they're just becoming more and more thoracic kyphosis. They're like kyphotic.
Yeah, and it seems like anxiety is becoming more and more a normalized thing.
Yeah, and part of that is because it's become more adopted, right?
Sure.
Like it's become more accepted.
Sure.
The other part of it is that you can't refute it.
True.
Nobody can say I have anxiety, and nobody can say to them, no, you don't.
Yeah. Yeah, like we were saying, there's no real
There's no test for it, right? So a doctor can tell you have anxiety. You can't refute that you don't, really. You can tell your doctor that you have anxiety. They can't really clap back and say, no, you don't. And if you do, especially in this day and age, if you do, you're a social pariah. You're evil.
Yeah, I think it's kind of like saying, oh, I feel really happy today. And people are like, no, you don't. It's like, well, how would you know? You don't know how I feel. Because it is, largely emotion-based. I mean, that's pretty much what it is.
If you're out there and you're in pain, if you're tired of the current medical system failing you over and over and over again, just giving you answers that numb you, pacify you to your symptoms, and are largely based on medication, injections, and surgery, and you want a different way, maybe even a better way, look for my book, The Spinal Truth, A New World of Medicine. In it, each chapter I talk about a different symptom, different condition, different body part, and how I view it a little bit differently than the current medical system, and how my treatment has helped so many people out there when they've been let down with the typical approach. This is the way I think medicine should be. This is the change in healthcare I think we deserve. So thespinaltruth.com, you can look for my book on Amazon, Kindle, Apple, and on audio.
Yeah, it's unfortunate that there isn't some sort of test.
Well, and then the other possible explanation for it becoming more and more common is that we are becoming more and more sedentary.
Right.
You're taxing that thoracic spine slowly over time. That's putting pressure on your sympathetic nervous system. That's causing your sympathetic nervous system to rest at an elevated level, which means it's more easily stirred up.
Yeah. So, unfortunately, some of that will be taken out of context, saying there's a miracle cure for anxiety and it's in your back. That's not the case. There's a potential, though, that a lot of your symptoms, or maybe all, or at least some, could be coming from your improper thoracic spine movement.
Yeah, and you can go onto our TikTok page.
Yeah.
You can see some of the patient testimonials. You have some patients espousing this, right? Saying that they had some anxiety, they had some brain fog, they had some fatigue, and just by working on their body, these symptoms went away. I have a patient right now in it's Denmark or Holland. I think Holland. She was having basically social anxiety. She didn't want to go out with her friends. She didn't want to socialize. She was actually working part-time. And she had neck pain down her arm. So she was having some headaches. So she was having, these are all kind of cluster symptoms of a thoracic spine problem. Worked on her thoracic spine, and within about, I want to say 3 to 4 weeks, she was going out more. She was staying out longer.
It's even if it didn't specifically affect your anxiety, if we're saying I'm having all these back problems, all these issues, and that's a back problem, and you fix that, that can potentially help with your anxiety.
Exactly,
So,
exactly what I'm saying. It's kind of fixing any of your, so we explained the anxiety in maybe 3 different categories, right? 2 of those categories are physical.
Right.
A physical problem is causing it, or a problem in a specific area of your body is directly causing it, right? At the very least, like trying to address those physical issues, even if it doesn't affect your anxiety, would at least affect those physical problems, right? But it has a large likelihood of affecting your anxiety levels at least in the sense of you're more willing to go out, you're more willing to tolerate things, you're more tolerant of stressors.
Yeah.
And put it this way too, if you ever had a headache and then somebody's trying to talk to you and you're just like, shut the fuck up.
Yeah.
Like you can't hear it, you don't want to hear it, or maybe you've had some pain or you've been sick and then your kids are yelling and screaming. How well do you tolerate them yelling and screaming when you're not feeling well?
Right, exactly.
Not at all, right?
Yeah.
Yeah. But if you're in a happy mood, if you're feeling good, if nothing's hurting you,
rolling off your shoulder.
Your kids are screaming, you definitely have more latitude for it, right? Somebody's talking to you and you weren't necessarily wanting to engage in that conversation. You have more patience.
Yeah.
So you can kind of see how that would, over time, like evince itself in all of your daily interactions. Not only do you not want to have them, not only are you less tolerant and pleasant in them, but you're sitting there thinking like, man, I'm in pain, I'm agitated, like, And then even when those get removed, you still have your physical symptoms.
Yeah. So I think it's a good challenge, or I don't know, just an offer, whatever. If you're out there and you have and struggle with anxiety and you've tried everything else and you want to try something different, try one of those foam roller exercises. You can find it on our TikTok page. Do it for what? How long should they do these exercises for?
4 weeks. Give it 4 weeks. Give it a good effort. 4 weeks, you do it twice a day. You wake up in the morning, first thing in the morning, you do your foam roller. And then sometime throughout the day, you do another set of it. Do it for 4 weeks. And see if your symptoms change. You know, see if your headaches, your neck pain, your dizziness, your nausea, your arm pain, a lot of these symptoms come from this area. And then also see if your anxiety is different.
One thing I think it's important to note about that is the journey, because I see this a lot with patients you treat, where I'm here the first time they come in and they have a million problems, and then I'm here 4 weeks later and they have 2 problems, but they acted like they didn't have a million problems before. Yeah. So I think it's important on these kind of journeys is to note or journal about your
and that's what I do, right? So on your first visit, I map out your symptoms. If you say I have anxiety, I'll then say when, how many times, how many times in a day, how many times in a week. If you do have an episode, how long does it last? If you do have an episode, what's the average intensity of that episode? What's the high of it? What are you doing for it? How much medication are you taking? How often? If you have an episode, do you have to go lay down? If you do, how long do you have to lay down for before you feel like you're better? What are the activities you're avoiding? I want to put as much objective data onto your subjective symptoms as possible. And I do that with any patient that comes in across any symptom. Mm-hmm. And anxiety is a real hard one to define, to delineate from, because I say knee pain, all right, pain's a little bit easier. My knee, if I squat, if I go upstairs, then it hurts. How much does it hurt? But if you say anxiety, it's more nebulous. Yeah,
very much so. So I think journaling, though, with some of that information can help you.
Yeah, I would definitely recommend before you start this, kind of exactly what you said, sit down and really map out your symptoms. What does it look like over the last week or so? What does it look like? And I tried to give you a few things already. How long does it last? How intense does it get? How many of them do you have? If you're struggling to get to sleep, how long does it take you to get to sleep? If you wake up in the middle of the night, how many times? If you wake up, how long does it take you to get back to bed? What type of medication or treatments are you doing for it? And because if you have the same symptoms 2 weeks from now, but you're also not taking medication, you are better.
100%.
And so this is the type of stuff that I have to work through my patients, because inevitably, like what you said, 2-3 weeks down the road, for example, I actually tell patients this sometimes. You'll ask somebody to turn their neck and they only get, first visit they say, I can't drive, I can't turn my neck when I drive. And I'll say, okay. Write it down. 3 weeks later, I'll ask, how's driving? Like, driving's never been an issue. Always been and you're like, damn it. They're like, well, I wrote it down, and there's no reason I would write this down unless you said it. And it's because you adapt to your new norm so quickly, especially when your new norm is your actual norm. Like, if you broke your leg, that's not your new norm. You're not going to adapt to it too quickly.
No.
Right? But if you revert back to the way you should be, the way your health should be, the way you should feel, immediately, like within days, you start to think, you forget the way it used to feel.
Yep.
Yeah. Jill, you recently started doing some of the foam roller exercise, and initially when you were doing it, you were in a lot of pain.
Yeah, at first I actually tried it because I had acid reflux the one morning, or I had like heartburn, which was weird because I had only really got that like if I ate something spicy or like acidic or whatever. And then you mentioned that it can help with anxiety, and I was like, all right, well, I'll just try it out, which I'm going to be honest, I thought it was a little bit woo-woo, just because I had never heard.
I hate the fact that I am out here saying this stuff. I am very logical, I'm very linear. I hate the fact that I'm out here saying something that sounds so woo-woo.
It just sounds like, all right, but I really didn't have anything to lose, so I tried doing it for a while, and Chris and I have talked about this. Like, I've gotten super anxious before just driving on roads like 309, where it's, multi-lane kind of freeway or highway. And I started doing the foam roller for a little bit. And then one day I was like, you know what, like maybe I'll just drive on 309. I had to go to Wegmans or whatever. And I was like, I'll just drive there and, see if I notice any difference. And before I would be in the car, like white knuckling the wheel the whole way there, just because I was always like, I'm going to feel anxious when I'm on there, like kind of a little bit gassing myself up about it. And I was driving and I was like, wow, I really don't feel that anxious anymore. Like maybe a little nervous here and there, but then after that, like I really genuinely felt fine after that. And I was like, all right. So I kind of started doing that with other places. Like if I would go to Philly, I would drive on like 76, which I had kind of been avoiding because it would just make me feel super, super anxious. And I was trying to do what you had said, where I was noting like, okay, what kind of symptoms do I feel? I would like, sometimes I would be in the car and I would get super, super hot. And it's like, 40 degrees outside. I'd have the air conditioning on because I would get so, just kind of like that agitated feeling that you would say. And it was weird to me because I'm thinking, why am I anxious? Like, I don't have something to be anxious about. And I've had anxiety before where, I have a big speech or something and I have to present in front of a lot of people, which to me makes sense because,
Sure.
I don't do that a lot.
It's an event coming up that you're anxious
right.
about.
But then I was getting anxious for things, like I said, going to the grocery store or just like going out to dinner with my friend, which I had normally not felt anxious about that. And I was like, why am I getting so worked up about stupid things like that? So then after I was doing the foam roll, I was like, okay, he was probably right. Yeah.
And again, it sucks to be that person. If you told me 4 years ago that I would be here on TikTok, I've never been on social media before. If you told me that I'd be on TikTok talking about anxiety and GI issues and brain fog among the orthopedic issues that can be treated from the spine, I would have laughed as well. Mm-hmm. It was kind of on accident, and over time that we started noting this. It was a patient would come in for their shoulder and we'd be working on their thoracic spine for their shoulder, and they would say their shoulder would get better, and they'd say, hey, my anxiety has been better, my energy level's been better, my brain fog's been less. And initially when they say it, you just kind of like, oh, that's interesting, and you just brush it off. But then when you start to hear it over and over and over again, eventually it kind of like sits with you, and then you start to think, well, why could that be? And then you start rationalizing that or looking it up, why could that be? And then you start realizing that there is a valid medical explanation for it. And then you start directly treating somebody for it. So it's not like I initially started treating people for brain fog or anxiety or acid reflux or something like that. It was, they would just by happenstance comment on it. And again, not every patient that you're treating for their shoulder or neck via the thoracic spine is going to comment on acid reflux, anxiety, brain fog, fatigue, right? So it's a rarer occurrence, which means it takes longer to kind of categorize. Mm-hmm. And then all of a sudden you start thinking like, maybe this is a valid treatment. So then you go directly at it and you actually start treating somebody specifically for that issue. And then they were getting better and you're like, holy shit.
Yeah.
And now you're online looking like an asshole.
It's funny that you just said that because I literally forgot about another symptom, which is probably connected. Is I would always get like a lot of shoulder pain, like in my clavicle, I guess.
Yeah.
Which it kind of goes with that like rounded
right.
position a lot. And now I'm like, yeah, I really don't feel that shoulder pain anymore.
Yeah. And it, like what Chris said, it's an evolution over time. You initially have some shoulder pain, you get used to it. And then you put more and more stress on that area, and then your symptoms evolve. Maybe they present like acid reflux, maybe whatever. Maybe they present like fatigue, maybe they present like just less tolerance towards movement and stressors.
Yeah, it's interesting too because I didn't really start to feel like the anxiety symptoms that I had until like midway through college. And when I was in school, that was right around when COVID had hit and we started to be, our classes were online. But before that, and even like grade school and high school, I was very active and I played a lot of sports. So I wasn't, even if I was kind of hunched over, there was still so much more activity.
Still breaking it up.
Yeah, there was so much more activity. And
how long did it take of you doing the foam roller until you felt like you noticed a difference?
Probably at least like a week or two. I think there were some...
And initially you were so sore you didn't think you could continue, right?
Yeah, that hurt so bad. I remember the first time and I was like, oh my gosh, I was like, how do people do this? Because I had watched you, show people in sessions and I was like, oh, they're just being dramatic. And I tried it and I was like, this is going to be super easy. And then I was laying down and I was like, oh my God, this hurts so bad. And even like a couple of days afterwards, my back was so sore. But then it kind of felt, when you go to the gym and you work out.
Sore.
Yeah, it feels kind of a good pain. And now when I do it, I get excited because I'm like, oh, it's almost like a little mini massage.
Does it hurt now?
Not really. I have noticed, like, if I haven't done it for like a day or so, it'll feel sore. Like, there was a day that I was going to brunch and I wanted to go grocery shopping early. So I did that. I skipped doing the foam roller. I did that. I went out to brunch, and then I was cooking later. And I was like, oh my gosh, my back hurts so bad. So immediately I was like, let me go do my foam roller, because I was kind of starting to get some of those symptoms where I was just like getting kind of antsy and like agitated. And then after I did, I was like, I do feel better. Yeah. And I do feel more energized too, which was kind of a surprising, because I was like, oh, maybe I'm just not sleeping enough.
If your body is sitting at constant agitation, right, that's going to take a toll. Yeah. If your body is sitting at constant elevated heart rate, elevated blood pressure, that's going to cause fatigue. Right. Elevated sugar, increased adrenaline. If it's sitting at that stirred up, if your digestion is slowed, right? So it slows your digestion if your sympathetic nervous system is stirred up. If your digestion is slowed, that's going to cause fatigue, nausea. And again, I know it's surprising to me now, although I've been sitting with this information and thinking about it for probably about 6 years now. It's surprising me now that I have to convince people that this is a possibility, because it sounds so linear to me. And again, I'm not saying that it is the cause, the only cause, but I am absolutely saying that it is a possibility. And all I'm saying is that the spine, via the nerves, innervates everything in your body. So any problem that you have can potentially arise from an underlying nerve issue at one or multiple levels. Mm-hmm. And it's worth getting it looked at and maybe even attempted to properly treat it before you go down the rabbit hole of medications, injections, and surgery.
One thing that you commonly say too, which I would encourage people to think about, is one of the ways you said you can tell if it's a nerve symptom is if your symptoms kind of come and go. And I would notice that before, where I would wake up some days and I'm like, oh, I don't feel anxious today. But then the next day, like if I had been sitting a lot or doing a lot of like forward motion, I was like, oh, what the heck? Why do I feel so anxious? So I feel like for me, if it was something more like trauma related, or, if there's something else, I would feel like your anxiety symptoms would be there. Yeah, and
I think that's really good. The on and off, that's definitely something I say. It's a little harder with anxiety because, you can be worried about something one day and then it comes and goes. But I think that's definitely a part of it. The other part of it is think about what you're doing at that moment. And for most people, it's going to be that you were just sitting slouched over in a car, at your computer, or like standing and cooking. Standing and cooking, you're looking down a whole bunch, right? So now start to categorize and correlate with what position your spine has been in. And if you constantly see that when you're driving for a prolonged period of time, like a 5-minute drive doesn't get you, but a 30-minute drive does. 10 minutes at your computer doesn't get you, but an hour does. Cooking, making toast doesn't get you, but cooking a whole meal does. And you're starting to notice that. Now you might be able to have a little bit stronger belief of, all right, the position that my spine is in is affecting my symptoms. Anything else, Chris?
I gotta do my foam roller exercise.
Want to do a shout out? Say hello, somebody?
Hey mom. I don't know.
All right, so that's our show for today. Next week we have another kind of interesting topic. We have somebody that was diagnosed with asthma. He went through all the normal process of going to his doctor, going to a pulmonologist, actually going to the emergency room because of an episode. Nothing was helping. Then he ended up seeing me, working on his spine, pretty immediately improved. So hear his journey, hear his story, see if it resonates with you or somebody you know, because that's another symptom that you wouldn't think could be a spine issue, and it often is. That's our show. Look out for us on TikTok, Instagram, Facebook, and YouTube. Thank you for listening to us on Spotify. Hopefully we gave you some information. Hopefully we kind of gave you something to think about or a new way to view some of your symptoms and maybe answered some questions that you have. If you have specific questions, you can reach out to us on those platforms or stay tuned next week for more.